and good to have you with us on this edition of the Urban Debate. Viewers, we've repeatedly got you data analysis based on the information that states and the center share with us about coronavirus, from number of cases to active cases, doubling rate, testing rate, all of those. And we here at Mirror Now have been collating that data, using that on the basis of a mathematical model to project where we are headed. It's always good to know for states to prepare. Delhi has gone into an urgency mode now because their own projections show that the cases could spike into lakhs. Similarly, we have been saying repeatedly that the states should know where they are headed. Cities and the city administrations must know where they are headed. You and I should know how our cities are doing, how our states are doing, so that we can plan our lives. So we have at least some idea of when this might all get over. Businesses should know what exactly is happening and how long it may take. They need to make their business policies, make their own plan for the rest of the year, which is why we repeatedly bring to you these projections. And one more time on the Urban Debate, we are going to do that. We're going to tell you how your state is performing. We're going to tell you how your city is performing. Frankly though, as the conversation proceeds, we are going to focus on the key states that are still a little bit of a problem for us, where cases may be going up or the relief isn't coming in as much as one would have expected. But before I do all of that, let me actually just tell you the big takeaways. And these are just some of them. There will be more as we go through the show. Corona cases for an overall basis are likely to peak in this country by around July 20th. Yes. Now, this peak has actually gotten delayed because of all the good steps we took, because we actually went into a lockdown, slowed the rate of infection, which is why the peak has actually gotten a little delayed than what was being projected earlier. And now it is likely to be July 20th. India is likely to have about 208,000 active cases. Now, mark my words, I'm talking about active cases, not total cases in July. That would be the number of patients at one point who would be infected with coronavirus will be needing treatment. All major states are showing a downward trend. Most of the major states are showing a downward trend, which is good news, viewers. We are beginning to get to the other side. But Maharashtra, Tamil Nadu and West Bengal are lagging behind the rest of the country. These are the three states that are still moving very, very slowly. And you know, as far as Tamil Nadu is concerned, 4 districts have gone into a lockdown from 19th of June itself. That's the point. And we will give you more insights and data to help you understand why this is happening. Chennai and Pune, as far as city goes, still have a lot of hard work to do. They are still showing an upward trend instead of a turnaround, or at least stabilizing. A lot of cities like Ahmedabad have just stabilized in terms of the recovery and active cases. Cases have begun to climb a little in Kerala. As Kerala opened its doors for people to come back from various foreign countries, for people to come back from various states, and lifted the restrictions of the lockdown, there has been a bit of a spike in the cases in Kerala. Now, how do we read into a little bit of this data? That's the key point. I want to start off with the state of Tamil Nadu. Tamil Nadu also, viewers, because including the city of Chennai, 4 districts have actually gone into a lockdown one more time. Now, this has not happened in any other part of the country. We were always prepared that there may be some places where if the cases spike, we keep going back into a lockdown. But look at the way the cases are projected to move. So as of June 19th, 22,000 active cases. This is the India outbreak data analysis that we are bringing to you. These projections are based on a mathematical model, but the basis, the inputs are actually what the government data says. So if the government says these are the number of cases, these are the projections as per those. June 30th, say 15 days from now, the cases are likely to go up to 28,000. By July, the cases will be hitting 30,000. And then you will begin to see the turnaround. So for Tamil Nadu, the journey is going to be tough for the next 10 to 15 days, which is why it's a good thing that some of the cities have actually gone in a lockdown. And they will climb up and up till the point they reach 30,000, and this will be around 5th of July. And after 5th of July, the active cases will begin to come down, which mean that it doesn't mean that there won't be any fresh cases, but more people will be recovering than those who will be getting infected. And it will still take some time for Tamil Nadu to fall below the 1,000 mark. That's only going to happen by end of August, that they have less than 1,000 cases. That will probably only have happen by 25th of August. Now, viewers, we have to keep in mind, variables can change. If any part of Tamil Nadu doesn't follow the norms, doesn't take precautions, doesn't follow the instructions, we may see a sudden spike. If they get strict with it, then these are the projections of the way we are headed. So let's start with this, and then I will tell you about Delhi, I will tell you about Maharashtra, Gujarat, Telangana, West Bengal, Karnataka. Karnataka, in fact, there is a lesson to be learned in how that state has handled the cases and how it's doing far better than some of the others. And we're going to do all of those. But first up, let me actually start by talking about Tamil Nadu. And Kovai Sathyan, spokesperson for the AIADMK, joins us this evening. Good evening, Kovai. Kovai, as per our projections, and so far we've been 96% accurate, a few cases up and down as far as active cases are concerned. So for Tamil Nadu, the road seems to be still tougher and longer for a while. Now, what is the plan of action? Do you foresee perhaps lockdown in more districts, or the steps that have been taken so far will be enough?
Thank you, Tanvi, for having me on the show. I'm so glad and happy to note down your projections and models. But as far as TN is concerned, the most challenge has come from the urban city of Chennai because of the density of population. So as the world knows that from today onwards, we have gone for a 12-day lockdown, and there is going to be an intense camping. We have organized about 680 camps. There are 200 wards in Chennai, so each ward will have 2 camps, and there are 140 primary health centers. So put together with the help of the primary health centers, we are hosting about 680 medical camps. So the Chief Minister has got a 5-pointer agenda. The first thing is to conduct fever camps, and the second point is to have early detection and testing. Third is how the patients are being managed because 86% of the cases emerging are asymptomatic. So as you are aware, by the guidelines of ICMR, a asymptomatic person can remain at home if he has got a restroom facility attached to his room. And effective contact tracing. The target given by the Chief Minister is to ensure that the family members as well as the other contacts are traced within 24 hours. So essential and smooth supplies of smooth supply is ensured on the quarantined areas. And for 5 streets, there is a volunteer who is put in place, and a person be nominated as a volunteer from the person who has got a COVID at home. The volunteer will coordinate. There are intense WhatsApp groups that is created, localized as far as each and every area is concerned. Yes, there is a turnaround which is happening. For example, I can give you a Kannagi Nagar, which hosts about 1 lakh households of Tamil Nadu Housing Board, did show some signs of turnaround 3 days ago. So I hope that the 5-pointer agenda which is set out by the Chief Minister starting with Chennai will definitely ensure that we are able to overcome this spread to the other zones and other districts as well. We'll be able to curtail this.
Yes, in fact, you know what is very interesting is, viewers, and this is what we had told you last time as well, Tamil Nadu had actually at one point of time seen the recovery rate higher than the active rate. And this was, around April end. There was, it looked like they were getting a grip on everything, and the number of patients recovering was much higher than those getting infected. But then in May, that turned around, and that's when we started seeing a lot more cases in, yes, and it's come, exactly, I was coming to that. And in May, the active rate went up, and a lot of that was like Kovai was pointing out for what happened in Chennai. And then around May end, again the recovery rate went up, and now it's stabilized. The recovery rate and as well as the active cases rate, they've stabilized with recovery rate higher, so that's a good thing. But are not a factor, Kovai, that's many people consider as a key indicator, which is one person, how many more can that one person infect, and that's still relatively high at 1.7. Do you believe that you will have to step up on imposing the lockdown and ensuring people follow the lockdown norms and that there are no violations, because otherwise this continues to be a problem.
Yeah, so far we have seen about four lockdowns, 4.0, and as you are aware that almost close to 5 lakh plus cases have been booked for violators. But this time I think the people have taken it seriously. They have understood the kind of effort the government is putting in. We have increased our testing. We are currently hovering at close to about 26K of testing per day. But as per the ICMR standards, they want to touch the 20K per million. So Chennai is closing at about 18,000 per million cases of testing. And as well as the recovery rate is still above 50% of the admitted cases. So I think people have taken it seriously. And the division of zones by appointing 5 ministers responsible for 3 zones in Chennai has given, and there is a micro level monitoring of appointing an IAS and IPS officer in charge for a zone, has really given the good feedback from the public as well. And yes, there are large amount of people who are coming forward to cooperate with us. As I was stating, the Kannagi Nagar, which is as good as very close by to a slum area, did a remarkable turnaround. People appreciated the efforts and they started following the orders and guidelines given by the government. So with such cooperation with the public coming en masse, I think what you pointed out is right. There was a slump in terms of the recoveries. From 56%, we dropped down to almost close to 47%. Then there is a turnaround. Now, currently, we can say that the Siddha, National Institute of Siddha has come out with a model of discharging patients within 5 days. And I think they have done about 100 case studies they have submitted for the approval with the government. So we are ensuring that no stone is left unturned as far as bringing this COVID under control and ensuring that the safety of the public is there. I think round the clock people are working, and I hope that with your model. But anyways, I have a couple of other models as well, because I'm surprised at a couple of states wherein the testing per contacts is not being featured in top 5, but those states are showing some decline. But wherein the contact tracing of Tamil Nadu is at second, we are at about 14.2 people per positive cases. So we'll ensure that still it actually reaches to the maximum, say about 40 contacts are being tested per person. I think with these kind of benchmarks which we have set within ourselves should ensure that we reach that milestone and the benchmark of COVID-free state at the earliest.
Okay, just to let our viewers know, the number of samples tested, the RT-PCR test that Tamil Nadu has carried now stands, as of June 16th, it stands at about 6,72,000. So the testing has been ramped up. I know the point that you're making about some of the other states, but honestly, yes, now of course it's gone up further, but I'm referring to the nationwide data that was given to us. Okay. And our projections are based on the data that the governments share with us. Some governments do lesser of testing, thereby discover lesser cases. Some ramp up their testing, and that also changes that entire scenario. There needs to be some amount of uniformity there as well. Very quickly, one last question, Sathyan, before I let you go. Your neighboring state of Kerala pretty much hadn't gotten rid of COVID. There was a time for 2 or 3 days where they weren't reporting any cases, and now as they opened up and people started coming from abroad, people started coming in from other states, the cases have gone up. Is there any thought process of, within Tamil Nadu of how much you want to open up travel for people? Will you be ramping up more flights or trains? What's the plan there?
No, we have requested to the aviation ministry to restrict the number of flights to Chennai. So they agreed to us and they said 50 flights will be operated. And we are tracking the persons who are traveling by the flights from which destination they are coming from. And as well as we have seen the model of Kerala, how it is working out. Kerala have stopped reporting asymptomatic cases because as per the guidelines given by ICMR, no asymptomatic persons are being tested and they are not being reported. But where in our case, we still report asymptomatic, which is 86% of the cases which we are confirming right now. So there is a basic difference. And if you see, Kerala is not in the top 5 list of contact tracings as well, but we are there in the number 2 slot of contact tracing. So there is a unique model which they are following and which they feel that is giving them the success. But whereas Tamil Nadu is considering the size of the population, close to about 8 crore people, active population of 7.5 crores. I think the methodology adopted by we are following the allopathy. We have given the free run for the Siddha to prove themselves. We have given the free run for Ayurveda to prove themselves. And there is a Kabbasura Kudineer in Tamil, which means that a combination of herbs which will boost your immunity, which has been given free. And apart from it, there are food camps which has been held across the state.
Okay.
The Amma Unavam is giving free food, so that the people doesn't lack of the basic amenities, including the food. People who are there on the streets, people who are migrants, people who lost their livelihoods. shouldn't roam around want of foods. So the food camps are being held across the city. The Chief Minister had ensured that each and every parameter is taken care.
Okay.
And there is one suggestion of taking the comorbids into the category of CCU. Like how you have ICU and CCU in a hospital. Now we have everybody, even the comorbids and morbids, as COVID into a COVID care. So there is a suggestion given, say, represented to the CM to have the comorbids into CCU, because you know that comorbid people are the ones who needs the vent support, which is 5% of the entire requirement right now of the cases reported. So if you are able to focus more on comorbids by treating them into the CCU, then I think we'll be able to lesser down the mortality rates. So there are different parameters and dimensions, and there is a consultation.
Well, there is no denying the fact. Yes, well, there is no denying the fact that for you the biggest challenge is the city of Chennai itself, where the cases will continue to go up even when rest of Tamil Nadu will see a turnaround. And Chennai, as per our projections, will only peak by July 3rd, and that's when it will hit 21,000 cases, and then it will begin to reduce by mid-July. It will come down to 17,000 cases roughly. So let's hope that the city of Chennai understands the seriousness of their situation and people follow norms. That's very, very important as the government goes about doing its work, ensuring testing, building up healthcare infrastructure, reporting on the numbers, taking care of the medical workers. People have to ensure that they maintain distance, social distancing is observed, and they remain indoors until the government thinks it's all right and they have a grip on the situation. Kovai Sathyan, thank you so much for joining us. We move on to the next big state. And the next big state, which was has always been, on top of the list in terms of number of cases, is the state of Maharashtra. And just like for Tamil Nadu, the big pain point was actually Chennai, which was reporting a high number of cases. In Maharashtra, it is Mumbai and Pune, two cities that actually have a majority of the cases that are being reported in Maharashtra even now. So let's see, what is Maharashtra's future looking like right now? The Maharashtra, our projections show that it too will peak around the time that Tamil Nadu does, July 5th. But the numbers are very different. At that point of time, active cases will be around 82,700. Now these are active cases, viewers, not the ones, not the total number, not the ones who've recovered. At that point of time, Maharashtra would have 82,000 cases, and then it will begin to come down. So by July end, the cases are projected to be 42,200, and then it will further come down. But the bigger respite for Maharashtra will also come by mid-August. Now, that's going to be the interesting point. If we don't break any rules and regulations, perhaps by end of August, we will hit a number below 1,000, and by end of September, we may be able to reduce our cases to zero. These are the projections as far as the numbers that have been given to us, and we've used these for that projection. I also want to very quickly tell you as far as Mumbai is concerned, because, well, a lot of it really depends on how the Mumbaikars really handle COVID and tackle coronavirus. So as of June 19th, the projection was, and it was roundabout in the same level, around 31,000 cases in Mumbai, which will go up to, or projected to go up to 37,200 odd cases by end of this month. But Mumbai would then begin to see a turnaround. This would be the peak for Mumbai. And then we will see the cases coming down slowly. But because the active number of cases just in this one city are so high, higher than so many other states and their cases put together, for us the journey is going to be longer. And we're only expecting to come below 1,000 cases in the month of September, and then by hopefully end of September not have any cases if everything goes as per the current scenario. So let's bring in our panelists, Clyde Crasto, spokesperson for the NCP, and Dr. Abhay Shukla, national convener of Jan Swasthya Abhiyan. Dr. Shukla, of course, understandably, Mumbai is the biggest challenge for Maharashtra. The crowded nature, the high density population, the way people, live here makes it extremely difficult to contain something like this. But do you think that Mumbai has begun to get a grip on the situation at least?
No, I don't think we can have such an optimistic kind of scenario yet. We are seeing, first of all, we need to acknowledge that there is community based transmission in large parts of Mumbai, something which has been, for some reason, been denied or minimized. We have, for example, the recent death audit which was conducted on, deaths which took place in Mumbai showed that 76% of the cases had no known history of travel or no known contact, which means that they were essentially, cases of community-based transmission. So we need to keep in mind that this is still the transmission is still underway on a large scale. A second point which we need to keep in mind is that the case fatality rates in Maharashtra and in Mumbai are quite high, higher than many other states. For Maharashtra, the case fatality rates are of the range of 3.7% compared to Tamil Nadu, which is only about 1%, and Kerala, which is less than 1%. And whereas Tamil Nadu, as we know, does have a large number of cases, as you have just noted, but still the number of deaths is much less proportionally. So Mumbai still has disproportionately high case fatality rates, and if we add some of the cases which had been missed out in the earlier reportings, then the case fatality rate goes up even higher. So it's about somewhere in the range of 4% plus. So this is quite worrisome. A third worrisome feature for Mumbai is that a lot of young people are dying. Roughly half, a little more than half of the deaths in Mumbai in the case study were among people below the age of 60 years. Now, this is unusual compared to other global scenarios. Even in countries like China or Italy, we have seen that the vast majority of people who died were actually very elderly people. But in Maharashtra, we are seeing, it's also true in probably other states of India, but definitely we know for Maharashtra and in Mumbai that large number of younger people are dying. People in the age group of 40 to 50 and 50 to 60 who should have recovered. And the third point is that people are dying shortly after reaching the hospitals. About 60% of the people who have died in Mumbai in the case series have died within 2 days of reaching the hospital, which means that either there was a significant delay in detecting these cases, which is probably the likely scenario, or that they were not being able to provide proper care, most effective care after they reached the hospital. The more likely cause is that cases are not being detected in time, they deteriorate, become serious, and then by the time they get a bed, which is also an issue, they may not always get a hospital bed in time. By the time they get admitted finally, perhaps they have become critical, and then that is perhaps maybe too late to save a large proportion of these cases. So these are some of the issues which we need to look at in the context of Mumbai. And I'd finally like to add that Maharashtra presents
Well,
highly
what is your
diversified.
own reading? I find your insight very interesting. Yes, Dr. Abhay, I find your insights were, intriguing. Why do you think this is happening, that we are seeing a higher death rate, even when it comes to youngsters, that a larger number of cases amongst youngsters, and even mortality? In general, if we see, Maharashtra has a higher mortality rate than many of the other states, of over 3%. But why is this happening amongst youngsters?
Well, that will need a little more study, but one explanation possibly is that many of these people have comorbidities. So we have in India we have a higher proportion of comorbidities among even younger people, and probably hypertension and diabetes are the two most important ones, along with cardiovascular disease. So if there is a higher proportion of comorbidities in younger people, then we might have higher mortality rates also among younger people. But this will require more analysis of the deaths which have taken place to
Okay.
understand why exactly it is so. But another point I wanted to add is about Maharashtra.
Okay, very,
It
very
is a
interesting.
highly,
Something that,
yeah. Hmm.
if I'll come back to you, if you can
Okay.
just hold on to that point. I just want to quickly bring up the chart. It was on the screens for city of Pune as well, because Chennai and Pune have been in focus for the way they have been reporting their cases. Pune is also projected to peak around July 5th, with almost about 7,000 active cases, from where we are right now, roughly about 5,500 cases. And then it will begin to come down, hopefully by between mid-August and August end, the number of cases will actually drop from 1,000 to just about 80 odd cases, and people can then begin to heave a sigh of relief, not let their guard down. We cannot let our guard down unless the world discovers a vaccine and a drug for this problem. But Clyde Prasto, the biggest concern, of course, for us remains Pune, and actually more importantly Mumbai, because in Mumbai the number of cases is so high, we are still struggling with the health infrastructure. Every day we are adding, but so are the cases. So it's literally, a hand to mouth kind of a situation, where one day if you have a couple of extra serious cases that need ICU, it could get problematic.
I'll tell you, Tanvi, Dr. Shukla was speaking before me, and I mean, with all due respect to Dr. Saab, because obviously, technically, I'm not going to argue with him at all, because he knows much, much more than I would know in terms of technicalities. But like we were speaking, like in a couple of points that he said that maybe detection is a little late, or there are youngsters who are losing their lives in this whole thing. See, my take would be that we've been saying that as soon as you feel some symptoms which could be related to COVID, you need to go and test yourself. And I think a lot of people are like waiting right till the end to actually go and get themselves tested, and that's when issues kind of double up, and issues go a little higher than they expected. And then like Dr. Saab said, that there are some of them are actually losing their lives within 2 days. So I think people need to immediately take a serious action as to if they're seeing some symptoms, if they know there's something going wrong with them, they need to start testing themselves, go for a test and things like that. And also at the same time, we are looking at things very, very positively. I've been seeing your graph. I've been seeing how things are going up. Yes, there could be a peak. There's going to be a drop, but at the same time, there are a lot of positive signs in Maharashtra and in Mumbai. Also, right before I go further, I'd like to tell you that we are a state and the city that's doing the highest number of testing. So the more the test, the more cases will come in front of you. The more we are going to help recover. The more treatment can be given. So we are doing a lot of testing, and that's out there in the open for you to see that a lot of testing has been done. At the same time, if you look at that, our recovery rate is really high. We're, going more than 50% recovery rate. And if you look at the graph, I have a graph in front of me, the government data, which I'm sure you have too. If you look at, on 31st March, the doubling rate was 3.5% in Maharashtra. Today in Maharashtra, it's about 25.9 as of yesterday evening, and in fact, Mumbai is even better. The doubling rate is like 30 days. So there is a lot of changes that are happening, a lot of good things that are happening, and we are looking positively. And like you said, we cannot shy away from a lot of things, because I've done a lot of debates on your show. You spoke about beds, you spoke about availability of beds, and we have been adding a lot of beds. We've had a lot of treatment is going on, whether it's at two phases at the BKC, the portable hospitals, or at Thana, or at NSCI. These hospitals with all the facilities, besides all the quarantine centers that we've got. In fact, if you in the last couple of days, we've taken a very good step further, where the price of testing, we've cut it down by more than 50%. So what was costing nearly 4,500 rupees to do a COVID test is now come almost 2,500 to 2,200 rupees. So that has also been done. So we are taking major steps towards working on how to bring this whole graph down, and make sure that people do not suffer further. And this is the positivities that we can take out of this. And obviously technically obviously different from what the administrative things are. Like Dr. Saab said, there are a lot of comorbidities that we need to look at, and if we work on those, maybe these cases will look a little different. But I personally feel, and what the government that I'm working with every day feels, that there are a lot of positive signs, and we are actually on the road to betterment, a road to going away from this pandemic that's made us suffer so much.
Yes, okay. I understand what you're saying. The mortality rate is high at about 3.7%. There's been a lot of data correction as well. But Maharashtra has a clearer policy on, what is actually taken and recorded as a COVID death, and comorbid cases are also now being considered there. So that may skew the data a little in comparison to some of the other states that don't follow that protocol, unfortunately. I want to tell our viewers in Maharashtra, because the battle has been tough, the battle has been long, and it will still take some time. But like Clyde was saying, there are some indicators for the recovery rate has increased at a steady rate. In fact, we also charted the recovery rate and the active cases rate, and for the longest time the gap between the two was huge when it came to Maharashtra, and it's now almost begun to converge. It's not turned over like for states like Tamil Nadu, but we're getting there. It's a slow process. The only thing which is still very, very crucial and important is that in Mumbai, we still need to focus on health infrastructure. We still need to focus on building that health infrastructure. And some of the policies, Clyde, very quickly, are actually quite confusing and too many flip-flops. Now, I actually want to raise this point because we ourselves were a little flummoxed with this decision that the civic body took, that they are not going to let the labs inform the COVID positive patients. The labs have to send the reports to the civic body, and then the civic body will inform the patients. It's something that even the Supreme Court today observed and didn't understand why it was being done and why it should be allowed at all. Why do we come up with such complicated rules?
I'll tell you what, Tanvi. I in fact raised my hand just to come to that point. See, the civic body, the BMC, has given a clear clarification on all these things. See, what was happened was, according to ICMR guidelines or ICMR rules, that an asymptomatic patient, okay, should not go directly to the hospital and get themselves admitted, because then when there is a symptomatic patient, that symptomatic patient gets difficulty in getting the bed. So what they did was that a lot of these people who went to the testing labs, they took their reports, even if they were asymptomatic, they went to the hospitals themselves, got themselves a bed, the hospital made their money, and they kept them for whatever longer period that they want to. And in those times, the patients that actually needed all help and needed all the treatment were not getting their best, because these were filled by asymptomatic patients. But ICMR guidelines was saying that symptomatic patients need to get the beds preferences much before an asymptomatic patient. So what they did was that if you report to the BMC,
yes,
no,
but Clyde, that makes I understand what you're saying. No, I understand what you're saying. But am I to now believe that the civic body is going to be quick and efficient enough in informing 1,000 people every day? What about the serious cases? What if there is a delay in informing the serious cases? Or you don't even inform the asymptomatic ones?
No, it's your word against mine. It's up to you to believe me or not to believe me. That's a different story. We can argue on that, but there's no point arguing right now. My point here is there are 24 wards. We have centralized this whole thing. Every ward now has, you can call every ward and check on getting a bed, availability of treatment and everything. So the BMC is working on it. It's not that you keep hunting. The last few days, you see that the whole thing has changed. We've decentralized it. You can call the area that you are, you can call your ward, you can get a bed in that ward. Things are working differently. Things are getting better. And this was on the same lines of the ICMR guidelines about the difference between a symptomatic patient and an asymptomatic patient. And the
guidelines are about admission and no admission. The hospitals can absolutely tell the asymptomatic patients, even if they insist on coming to the hospital, to go back, to take the right away from the patient. For them to wait even 1 hour extra, I don't think makes sense at all. But I am running out of time. So and Supreme Court has taken up the matter, Clyde. So let's see what they have to say.
To finish, so I don't know why you're not doing that. You always allow people to finish. Your show is known for that. So can I finish my sentence, please?
And I'd like to add something here.
Yes, I'm listening.
Yeah, my point is that you say if someone does not get a bed within an hour, that is what I'm trying to say. That it's proactive action that has been taken, and we were only trying to make sure that because the symptomatic patients should get the right treatment at the right time and urgently, this was devised by the BMC so that, these people get preferences. So this is what was done according to ICMR guidelines. And if and buts can take place in this thing, but the point here is all this exercise was done to make sure that no symptomatic patient who is in trouble goes away without, and they get preferences. So that's why this was done.
Okay, I disagree. I know the explanation. I don't think it makes sense, but we will agree to disagree on this for now. Very quickly, Dr. Shukla, you wanted to make a point before we move on to the next state.
Yeah. So 2 or 3 quick points. First of all, when patients are given the test report, they can also be given written information. If you are asymptomatic, please do not approach a hospital. And instead, phone up the following helpline and get information. Something like that. So patients are given information along with the report of the test, which will allow them to, behave in a more appropriate manner. That is one. But the second more important point is, I think these figures which are being projected for Maharashtra are overly optimistic, and there have been modeling exercises done for the city of Pune also, and these are showing that especially crowded areas of the city where high levels of transmission are taking place are going to continue to have significant number of cases, and the curve may extend anywhere up till November. So we need to keep in mind that Maharashtra, there are many Maharashtras. Mumbai is an entity in itself. Larger cities like Pune or Nagpur or a few other cities have a different kind of curve, and the rural areas and smaller towns of Maharashtra, which have still not really seen large numbers of cases, we may see second waves or even third waves in Maharashtra in the coming 3 to 6 months. So I would say that we need to be a much more, kind of cautious about this. And finally, about private hospitals, I would like to strongly make this point, and Mr. Crasto probably can, respond on that, that we need to actually take over private hospitals for the next 3 months in Maharashtra to provide COVID and non-COVID care. The government of Maharashtra needs to take this step. It has taken some positive steps, which definitely should be appreciated, but we are still not having sufficient health system,
So for example, in city of Mumbai, they have almost 80% of the beds, even in private hospitals, sir. Perhaps that needs to be extended to few other cities. Really sorry, Dr. Shukla, but I'm completely out of time as far as Maharashtra is concerned. Thank you so much to you and Clyde for joining us. We will continue the conversation for no other reason but for the benefit and for the good health of people of Pune. I hope that what we are projecting is actually closer to the reality than what Dr. Shukla is saying, because if it has to go until mid-November, it's going to be a tough journey for the people in city of Pune in Maharashtra. But thank you for joining us. Let's move on and let's get you now the big one, the national capital itself, the one that's already been in news for far too many cases on a daily basis in the last 2 weeks, for the entire testing, low testing that has now finally been ramped up, and 18,000 to 20,000 samples are being tested every day. So what does it look like for Delhi? And here is some good news in a sense, viewers, because our projections are starkly different from what the Delhi government has been projecting. Now, their mathematical model may be different, or maybe they know something that we don't. We are only basing it on the numbers that the government gives us. But as far as our numbers project, by June 30th, Delhi will see about 41,469 cases. By July 4th, Delhi is projected to see 47,461. Again, to emphasize, these are active cases at that point of time, doesn't factor in the ones who've already recovered. And then what we are looking at is the beginning of a turnaround, to say that by end of July, the number of active cases will come down to 15,900, roughly 16,000 cases. But it will only go below the 1,000 mark by mid of August. And just like several other of these key problem states, even for Delhi, the projections show that it may almost have no cases by the month of September. But as far as the Delhi government itself is concerned, they say that there is a possibility of 5.5 lakh cases. Those are, of course, total cases. But even if you remove the active ones, it's still nowhere close to what we are projecting. So we'll have to wait and watch how this goes. But let's say good evening to the panelists who are joining us for this round of conversation. And I've got Dr. Sanjeev Bagai, Chairman for Nephron Clinics, and Dr. Harish Gupta, elected member of the Delhi Medical Council and National Medical Commission as well. Dr. Gupta, let's begin with you. To you, to your mind, now as we ramp up our testing, get stricter with our imposition of the lockdown, is it possible that we look at a turnaround by mid-July?
Uh, as far as, are you able to hear me? Are you able to hear me?
Yes, I am. Go ahead, please.
Yeah. Uh, what we are seeing is that there is a surge of patients, maybe around 10,000 odd. We are seeing a Delhi, maybe 2,000 cases are added. But I think as the things are improving now, there is a lot of turnaround in last 1 week in Delhi. We have more testing facilities. The antigen test has also been added to it in the containment zone. The people are house to house are being tested. So, and there are more health facilities being added. So probably, I think, see that Delhi will start a better chapter in its history, and gradually we will have lesser number of cases Delhi. But what I still think which is lacking in Delhi is that campaign. Still, a large campaign is needed, which is should be a public movement to tell the people, please use mask. There is nothing more great than using a mask, having a social distance of 6 feet, and having a physical distancing and hand sanitization. So that is what is more needed. We still, when we go out on the streets of Delhi, that people, maybe few are 30% are without mask. People are not covering their nose fully, not maintaining the social distance, and hand sanitization should be a priority. That movement will directly decrease the number of cases. But right now, there are few positive things in Delhi. We have increased the number of labs. The testing facilities increased, so people can get the test done. They can they isolate themselves. So principle there again is test, isolate, educate the people who are asymptomatic or who can be in quarantine facility only. But we have to be prepared, for there are 15% of the patients who require ICU care and maybe 3% of the patients who require ventilatory support. Our effort should be to prevent loss of life. That should be our aim, and our all preparedness should
Yes.
go that smaller hospital, nursing homes, and other quarantine facilities, they can take care of the people who are less sick, who are mild cases, and maybe little moderate cases also. But those 15 to 20% cases who require ICU have to be given that support, so that they do not require the ventilatory support and they have very significant mortality. I will add one more point, especially in Delhi. But we are seeing it, the maximum problem we see in the patients who are elderly, who have comorbidities. So a campaign has to be there that please take care of your elderly. Please do not allow them to go out of the house till it is very mandatory. They should have the same three principles of mask, hand sanitization, and physical distance. And the people with comorbidity, they are also not faring well, especially the patients with hypertension, diabetes, heart disease, COPD,
Yes.
immunosuppressed patient. So these are the two
Yes,
hallmarks
I
which I think
understand what
should be
you're
there.
saying, and these are the people who have to be on alert across the country, actually, not just in Delhi, more vulnerable
Yeah.
to an infection like corona that could trigger other problems for them. So I understand what you're saying. Dr. Sanjeev Vagai, one point that I wanted to ask you about is the positive cases rate in Delhi is relatively higher than what we are seeing in rest of the country. Now, Delhi may have tested lesser. We're still, a little below 3 lakh tests in national capital versus some of these other states or cities which have similar number of cases. But Delhi is seeing more positive cases. Now, is that a concern, and why do you think that's happening?
Good evening. The first point which I would like to mention is that the total number of positive cases is not an ominous sign. I think it's extremely important to identify who are the positives so that we can then take the precautionary measures. With regards, how do we identify the positives, even if the numbers are increasing? It's with the judicious mix of what is presently now the rapid PCR test, but we must include and must introduce the ELISA test. That's the only comprehensive way you can actually capture the complete cohort of even the recovery patients. I must add the asymptomatic carriers. Now the recent data has shown that they can continue to shed the virus up to day 47. So the earlier understanding was 15 days and then 20, but now it's almost up to 1.5 months. Now, if the asymptomatics continue to shed the virus through the oropharyngeal and the nasal tract, they can continue to infect others. It's also important that every death, especially in a hospital setting, would have infected more than 130 people. So what we really need is a very flexible, very comprehensive, integrated approach. I'm not worried again to mention the total number of cases, because the only true matrix, an actionable matrix, is the total number of patients divided by what we call as the corrected case fatality rate. So if we keep the death rate down, we would be in a much better position. What is going to hurt not only in Delhi but most metros is what we call as the famous dreaded Cs. That's closed spaces, close contacts, crowds, clusters, community living, and comorbids. Unless and until we don't protect the comorbids and the elderlies, our case fatality may go up. And last, most importantly, is there has to be a very large public campaign that relaxations does not mean throwing caution to the wind. It's no graph, whether it's incremental or it's exponential, is intuitive, because the human behavior is unpredictable. So we must educate the people that unless until it's a dire emergency, do not go out. Manpower will become a big issue with regards to the trained doctors, nurses, and skilled technicians. So I think creating beds is one thing, but arranging the adequate manpower will be a huge challenge. At the moment, our healthcare facilities are just about starting being stretched. Now, if we take precautions, we'll still be able to keep it at bay.
Yes, no, you're absolutely right. This is a problem that we've highlighted in the past as well for cities like Mumbai and Delhi. It's not just, viewers, about adding beds. It's also about adding the healthcare professionals who are needed there. Already those who are working in the current setup are stretched, overburdened, overworked. They've been at it non-stop for 3 straight months. And now if cases are added, more facilities are added, then the government will have to start looking at other options, seeking help from maybe its neighboring states, whoever can afford. So it's a good thing at least that the center is now personally also looking into the Delhi situation, and the state and the center seem to be working together. I'm out of time, so I'm going to thank both of our panelists for joining us right now. A good point that Dr. Bagai made was about the fact that even if the positive case rate is high in Delhi, which means if in the rest of the country out of 100, 18 to 20 are testing positive. In Delhi, it's 25 to 30. It went up to actually 32 at one point. It varies on a day-to-day basis. Let's also see if this changes as the testing gets ramped up, as the testing now goes from 5,000 on a daily basis to 20,000 on a daily basis, and what happens then. Thank you so much to both of our panelists for joining us on this conversation. Very quickly now, let's move on to Gujarat and get you the Gujarat numbers as well. It's a state that was registering quite a high statistic in the initial days. It's also a state that will see its peak come much later than some of the others. Tamil Nadu and Maharashtra, even Delhi are slated to see their peak first week to midweek of July, but not for Gujarat, interestingly. And I'll tell you why. I'll explain that to you. But as of our projections for Gujarat, by June end, there would be around 6,700 cases. By July 25th is when the peak will hit, for about 3,000 cases. And then by July 30th, it will come down to 2,490 cases and further go down. But by August 15, they will have less than 500 cases. The state of Gujarat is projected to have less than 500 cases. So that is going to be interesting as well. Very quickly, I also want to tell you that for Gujarat, what is interesting is that the graph that has moved between the active cases and the recovery rate. The active rate and the recovery rate had a huge gap. And then at one point around end of May, they converged. And then the recovery rate became higher than the active cases rate, which is a good sign. More people are recovering than those getting infected. But now they too seem to be moving in a straight line, parallelly. It's very intriguing. If you show it to any statistician who's been tracking this data, the way number of cases for recovery and active cases are being reported in Gujarat. The big concerning point though, and which is what I will be asking my guest, Mr. Yamal Vyas, senior leader of the BJP from Gujarat, joins us this evening. Mr. Vyas, while the R naught, which is the infection rate from one to the other, is lower than other states, the mortality rate is very high. It's the highest in across the country for Gujarat of 6.24%. Why is that happening, and what is being done to resolve this problem?
You see, initially I think it was very high, and I'm not a medical man, so I'm a finance man, but I can tell you that the kind of efforts that are being made by the government across the state, especially Ahmedabad, which is the worst state, almost 60% of the cases, and in Ahmedabad, the kind of efforts that have been made are commendable. I don't know about the other cities, but Ahmedabad, like its contact testing, I mean, the number of tests that have been executed, everything, every care that could be taken from about the second week of lockdown, it has been very, very active. Unfortunately, we had some problems of people coming from outside the Tablighi Jamaat people and all. There were so the containment areas of Ahmedabad, which had a very high mortality rate also initially, and that unfortunately has continued. We have been able to bring it down subsequently, but that overall numbers are still pretty high as compared to other cities, I agree. But the kind of recoveries that are taking place, the new cases that are being reported, I think we are very confident that more or less Corona is under control in Gujarat, especially in Ahmedabad.
Yes, I understand what you're saying, but even, for Ahmedabad, the cases have now come under control. But fact of the matter also is, Mr. Vyas, that it's very intriguing how the active cases are also continuing at the same level, and the recovery is also continuing at the same level. Now, is there a concern that we are not able to bring down the infection, that what you achieved maybe 3 weeks ago, you're not being able to improve on that, which is why the overall recovery for Gujarat may take longer?
No, I'll tell you why. There is a basic problem, Ahmedabad is like two parts. It's the old city, which is to the east of Sabarmati River, and there is the new city, Western Ahmedabad. So initially, all these congested places which are in the east old city, they were the affected area where there was a huge number of infections as compared to the population. And initially, as I said, a lot of efforts were made. It was brought down. Now, the number of cases, new cases, there are contained, very much under control. Now this is spreading to different areas in the Western Ahmedabad.
Okay.
So what is happening is that the population is almost 1/3, 2/3. So 2/3 is in Western Ahmedabad, where now they are all societies and no congested. There are some slums, but they were all initially affected. So now this is spreading into middle class areas. So the number of cases, for example, in Ahmedabad on an average for the last 1 week have been 500 cases daily, and recoveries are about 350. So there is a gap of 150, but the geography within the city is changing. So what we feel is that these are all India, Western Ahmedabad, they're all recovering very fast. So it may take a little time, 10 days, 12 days, but after that it will come, again the number of active cases will go down very fast.
Okay, all right. I'm a little short on time, but thank you so much for joining us. The one concern that remains, perhaps because of larger number of deaths in the early days, but it is the high mortality rate of Gujarat and specifically of Ahmedabad. It goes up to 7% when you speak about Ahmedabad. The national average of mortality, or the number of people dying versus total number getting infected, is 2.8%. But when you look at the city of Ahmedabad, it's 7%, viewers. That's why it's a concern, and that's why the Ahmedabad and the Gujarat health infrastructure needs to be ready, because you will end up seeing more serious cases in this place than in any other place. Quick break. On the other side, lots more. We are yet to discuss some interesting states including Karnataka and Telangana. Stay with me.